Hi dears, welcome to Ezinurse. Today we can have a discussion on ABG and we can do one question that is related with the ABG analysis. Okay, before going to further clarification, we can have a small discussion regarding what is ABG and what are the indicators of ABG. We can go with definition of the ABG. What is ABG? The ABG that stands for Arterial Blood Gas, a diagnostic blood test that measures the level of oxygen, carbon dioxide, pH and bicarbonate in arterial blood. The ABG that is usually performing the patient who was admitted in intensive care unit and emergency. So it is a critical situation. That time we need to collect the patient blood and we should assess the patient blood by getting PCO2, pH level and bicarbonate level to prevent the further complication that is related according to the patient condition. The normal values of the ABG are pH 7.34 to 7.45. The pH level would be 7.34 to 7.45. Then we can consider it as a normal. Okay. Then the PCO2. The PCO2 that is partial carbon dioxide level, it would be between 35 to 45 mmHg. Then bicarbonate that is HCO3, it would be 22 to 26 MEq by L. These are the normal values of the ABG. If there is any variation in pH, PCO2, bicarbonate, then it will be affecting the patient condition. And PCO2 that is related with lungs and bicarbonate that is related with kidney. Pre-procedure. Before doing before performing the ABG, we should do a test. The test we can call it as a Allen's test. Before the procedure, we need to explain the procedure to the patient. We should inform the patient why we do ABG and what is the reason, what are the purpose of ABG and what are the benefits of ABG and what are the measures we can take after assessing the ABG. We should have a clear explanation to the patient before the procedure. Should check Allen's test before radial ABG to check collateral circulation. The Allen's test we should do to check the collateral circulation, and usually we are collecting the blood from vein. In this case of arterial blood gas analysis, we are collecting the blood from patient artery. Next, we have a discussion regarding Allen's test. Why we are doing Allen's test? To assess the ABG, and before Allen's test we have to explain the procedure to the patient and take consent from the patient to check the collateral circulation of the patient. Then only we can collect the blood from the patient artery. So we are usually preferring to collect the blood from the radial artery. Allen's test is a clinical test used to assess the patency of the radial and ulnar arteries in the hand. It determines whether it is safe to draw arterial blood from the radial artery. Usually before performing procedure like an ABG test or placing radial artery line. Next would be the steps of ABG. The first step would be, I already discussed you about the pH, PCO2 and bicarbonate. First we have to check the pH level of the patient. If the pH is less than 7.35, that is indicating the acidosis state. If the pH is greater than 7.45, that would be indicating the alkalosis stage. Then we should check the PCO2 level along with bicarbonate level as well. So we could have a discussion regarding a question that is related with ABG. A 58-year-old man with a history of chronic obstructive pulmonary disease presents to the emergency room with increasing shortness of breath. His ABG results are the pH 7.32, PaC2 that is partial carbon dioxide that is 56 mmHg, the bicarbonate that is HCO3 that is 28 MEq by L. These are the ABG levels of this patient. Okay, so as you know that the patient age is 58 years old and patient has a history of chronic obstructive pulmonary disease, and usually if the patient is having COPD and the patient will experience hypercapnia. hypercapnia. The hypercapnia, that is the increasing the carbon dioxide level in the patient blood, because the patient is always trying to take the breathe, but the carbon dioxide is not releasing out. Okay, the patient is always trying to take the oxygen, but the carbon dioxide is not releasing. Okay, so the patient carbon dioxide level will increase in the blood, that is hypercapnia. Okay, look at here, the pH is 7.32. So the normal value will be 7.35 to 7.45, because it is less than 7.35. It is approximately, that is indicating the acidic state, right? Okay, then PaCO2. The PaCO2 would be the 56 mmHg, and the normal level will be the 35 to 45. And HCO3, that is bicarbonate, 28 MEq by L, 22 to 26 MEq by L. So here the whole PaCO2 and HCO3, the both are elevated, then pH is approximate to the normal value. Okay, so that means the kidney is trying to compensate the pH. Okay, the pH is 7.32 and the PaCO2 is 56 mmHg, that is normal is 35 to 45, and it is more than 45, right? It would be more than 10. And HCO3, that is 28 MEq by L, 22 to 26, it is near to normal level. Okay, that means the kidney is trying to compensate the pH. Okay, that's why the pH came to the 7.32 and PaCO2 is high, that is 56 mmHg, and bicarbonate is 28 MEq by L. We can consider this condition, it is definitely in COPD, there is a acid accumulation will be there, the carbon dioxide is accumulating over there, and the condition is hypercapnia. So then we can consider that condition is the PaCO2 is elevated here, so they can consider the condition is metabolic, and the pH level is 7.32 and less than 7.35, we can consider it as an acidic state. Okay, acidosis. Okay, so the condition will be metabolic acidosis. However, so the 7.35 to 7.45 is the normal range. So here, look at here, the pH is 7.32. So it is approximately to the 7.35. That means the kidney is trying to increase the level of bicarbonate. Okay, so that's why the kidney started to compensate the pH level. So that's why the pH that reached about 7.32. Okay, so we can call it as the compensation is started. The kidney started to have a compensation. So this condition we can call it as a partially compensated respiratory acidosis. So what is the most appropriate intervention of this ABG result? Uncompensated respiratory acidosis. Not. It is not a right answer because it is not compensated. Partially compensated. The kidney started to compensate. That's why partially compensated respiratory acidosis. The metabolic acidosis not. Metabolic alkalosis not. Because the pH level would be less than 7.35 and acidosis because it is less than 7.35, however it is near to the normal level, so we can consider it as a option is B. The B would be the answer, the partially compensated respiratory acidosis. Okay, I hope that you got an idea about the ABG and how you evaluate the ABG result. First look at the pH level, then you can move to the carbon dioxide level, that is PaCO2, and then look at bicarbonate level. The PaCO2 that is completely related with the respiratory system, and the bicarbonate that is related with the kidney, and pH level that would be less than 7.35, that is indicating the acidic state, and more than 7.45, that is indicating the alkalosis stage. And if you have any doubts regarding these questions, please feel to contact us. We are very glad to help you. Thank you throughout this series. Once again, I express my sincere thanks to you.